morning. So I'm going to do cuff management with the oral cares. So the first thing I'm going to do is check the patient's chart, gather any of the necessary items, anything that any information that's going to be vital for me going into the patient's room. So first thing, I'm going to knock on the door, introduce myself, check the patient's ID band, and then I'm going to go ahead and do the vital signs, listen to their lung sounds, make sure everything sounds okay, and note the size of the tubing, or if they have a stoma, always notify that. So if they have endotracheal tube, note the lip level before you begin. So you're always going to do a cleaning before you do any cuff management. Opening up, loosening that cuff can make anything drop down into them. So you don't want them to aspirate anything. So you're going to set up your canister up to your meter there. And then you're going to take a yank hour and you're going to set that up, connect it like that. You want to always suction out any excess stuff before you clean, in the back of the throat, side of the mouth, anything like that. When you're done, shut it off, put the sheath on, and put it in a protective area. So when you are doing a cleaning, if they have a strap around them where a handle or anything that needs to be removed, always hold on to your tube, that way it does not move, and retie it if you need to. So next is our oral care with them. So what you're going to do, this one here is the suction swab one. So you're going to take your oral agent, you're going to dip it into your oral agent, and you're going to wash the sides of the mouth, around the gums, and the back of the tongue. So that way it gets all nice and clean. If you have any excessive cleaning in there, the oral agent in there, you can connect it to your suction handle here, and you can turn it on and you can suction out that excess stuff. So dispose of that. And then you want to do your moisturizer. So you always want to moisturize the sides of their gums, their tongue, and their lips. So when you're doing the cleaning, you always want to move it side to side, so that way you get all sides of the mouth evenly and make sure they're all clean. So dispose of that and suction any excess stuff out if you need to. Then you are ready to do your cuff management with the patient. So what you're going to do is you're going to have a syringe, you're going to have a meter, and here we have a three-way stop. So here we're going to take our syringe here and you're going to connect it there. And then you're going to connect your meter so that way you can keep track of where it's at. And then you're going to connect it to your pilot balloon right there. So when you're going to do this, you're going to go ahead and take your stethoscope and you're going to listen to the side of the patient as you begin to do your minimal leak test. So when you're doing your minimal leak test, what you're going to do is slowly remove the air from the balloon. And when you start hearing that gurgling or crackling sound alongside that balloon, then you need to stop. And then you're going to notify what the meter says when you do that. So next is the minimal occlusion test. So what you're going to do is slowly push that air in there until you don't hear it anymore with your stethoscope. And you're also going to take note of where it is on the meter. So always after you do a minimal leak test or anything like that, you always want to double check to make sure that cuff pressure is at the appropriate level. So what we have here is our low pressure cuff here. So what you're going to do is take and put your pilot balloon, connect it to there like that. And so then it'll tell me here, okay, so there's not enough pressure in there for that patient. So what we're going to do is slightly increase it like that. So you want them between the 20 and 30, but here we have the green here. So if it's ever above that range, you want to take your red button here and just slowly decrease it so that way it's in your appropriate lining where you want it. And then that way you know the cuff pressure isn't too much to where it's going to cause any sores on the patient. And if it's too low, then you know they're not going to aspirate anything. So when you're done, you always want to recheck the patient. You want to get their post-vital signs, check their lip level of their endotracheal tube. If their endotracheal tube was on one side, move it to the other, so that way they don't get any sores from it sitting right there. So once I'm all done, remove my PPE, wash my hands, and then I chart on the patient's charts.